What are patients most afraid of in the dental office? Probably being in pain. Do you have a pain-free dental practice, meaning that your patients have no pain after surgical procedures? Do you follow these 8 important steps that I'm going to cover with you? Most of us were never taught this in dental or medical school, but they're very important in terms of alleviating post-operative pain. So I'm going to go through these 8 steps with you slowly over the next 4 or 5 minutes. Number 1, before surgery, we go over pre-operative instructions with our patients. We give them a written correspondence. We hand it to them. We tell them exactly what to do before surgery. At the same time, we go over post-operative instructions. We go over post-operative instructions before surgery so the patient knows what to expect after treatment. And this post-operative instructions will be the medications that they take afterwards, how to take them, etc. We also encourage them to get all these medications before surgery so that they're ready for them at home and they won't have to worry about getting the medications on the way home from the surgical procedure. Second thing is we offer them sedation. Now you may not be comfortable doing sedation in your office, but you can use nitrous oxide, you can use oral sedation like triazolam or some sort of a benzodiazepine, which are simple to learn about and very safe. Or you can use IV sedation, bring in an anesthesiologist, or if you're comfortable doing it yourself, you can do it yourself. We bring in an anesthesiologist about once a week so our patients can go to sleep if they want to do so. By keeping people very comfortable during the active phase of surgery, we decrease their stress level, lower their cortisol, and they have less post-operative pain afterwards because they don't have all of that stress. It makes a really big difference. The third thing that we do is we prescribe non-steroidal anti-inflammatories such as Motrin or acetaminophen if they can't take the NSAIDs before treatment. We have them take this 1 hour before treatment at home or on the way to the office so it decreases prostaglandin formation. By giving the pain medication prior to beginning the surgery, we find that there's very rarely any postoperative pain and almost never a need for a narcotic. I probably prescribe a narcotic 3 or 4 times a year at the most, and it's only at the request of a patient that thinks that they need it. The research has showed us that a combination of non-steroidal anti-inflammatories plus acetaminophen will decrease postoperative pain more effectively than taking narcotics. And there's about 15 articles in the literature right now that have shown that they've been published over the last 10 to 15 years. The fourth thing that we do is we prescribe arnica. You may not be familiar with arnica, but we've been using it for about 35 years in our practice. It is a homeopathic medication used by a lot of chiropractors and plastic surgeons. We give it orally. They start taking it 2 days before surgery, and then we give them a cream to take that they can put on their face if we have a lot of swelling afterwards. So the arnica decreases postoperative swelling and bruising. Now, a lot of people don't believe in it, but our patients seem to like it a lot. As a matter of fact, some wanted to cancel their surgery because they didn't take their arnica beforehand. Now, I wouldn't do that, but I think the placebo effect might be effective as well. I can't give you very hard science for it, but using it for about 35 years, I use it on every patient. It seems to make a difference. Personally, I use the arnica cream if I have any back soreness, and I find that this works very well. Now, the last thing before we do after the surgery is to use a general surgical technique that makes sure that patients are comfortably numb throughout the procedure. We don't traumatize them. We try to be as gentle as possible. I'm sure most of you do that. At the end of surgery, we give the patient long-acting local anesthetic. Marcaine is the one of choice in our office. It lasts for about 4 to 6 hours. That way the patient won't have any pain for 4 to 6 hours after surgery. Now, they already have on board a non-steroidal anti-inflammatory or acetaminophen, and they're leaving numb. It depends upon how much time the surgery took, but about 3 to 4 hours after the initial dose, we'll give them another dose of a non-steroidal anti-inflammatory or acetaminophen. Now, why give them a medication if they're still numb or if they're not in any pain? Because it builds up. We get a dose level that's a little bit higher in their body so it can stop the prostaglandins from forming. Most of our patients have zero pain in the first 24 hours, but they're still taking pain medication. This is very effective at making them more comfortable. Matter of fact, most of our patients don't have any pain until day 2 if they're following our instructions. And on day 2, they're taking their medication, they still won't have any pain. So by giving a long-acting local anesthetic, you can keep them pain-free for a long period of time and give them an opportunity to take a couple more doses of the medication, even though they're not in any pain. That leads us to number 7. We give them a dosing schedule. So if a patient comes in, let's say they have a 10 o'clock appointment, they took their initial steroid at maybe 9, and then leaving the office at about 12, I say, well, At 1 o'clock, take another dose of the non-steroidal anti-inflammatory, and then 4 hours later, it'll take us up to 5 o'clock, take another dose, then 9 o'clock, then at bedtime if they're still up. So we tell them exactly when to take it. We write this down on a piece of paper for them. It makes it very easy for them to follow the dosing schedule. We also, number 8, give them some ice, tell them to sleep elevated pillows so they don't bruise a lot, and we recommend that they don't exercise for 48 hours, which will increase blood flow everywhere, which can increase more swelling. So by following those 8 steps, pre- and post-operative instructions at the same time, consider sedation, number 2, utilizing a pre-operative dose of a non-steroidal anti-inflammatory or acetaminophen, utilizing arnica, gentle surgical technique, long-acting medications. Okay, afterwards, with a dosing schedule and giving them ice, it makes a huge, huge difference. So by following this simple protocol is one that we figured out, over the last 35, 40 years, makes a big difference. I was never taught this by anybody in dental school. I was never taught this during any residency programs. It's something that I figured out over a period of time, and I wish more people would follow this schedule. Almost nobody, in my opinion, follows those 8 steps, but they're so simple, okay, and anybody can do them. By doing this, you'll have a pain-free practice, you'll have happier patients, and they won't be apprehensive about going through the next procedure. And you get to be the gift. Have a great day, everybody.